Hello, everyone. Good afternoon, everybody. I'm Priyanjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today, we are talking about something that affects everyone, no matter where you live: fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking early action. Fungal infections like athlete's foot or nail fungus might not be the first thing that we think about when it comes to health, but they are important and can cause serious problem if we ignore them. They can make us really sick if we don't deal with them properly. But don't worry, we are not just here to talk about the problem. We are here to talk about what we can do about it. We will look at how to stop fungal infections from happening and talk about the latest treatments. This month is all about being aware of fungal infection and how to stay healthy. So let's connect today with our skin expert, Dr. Nyla Ishtyaque from Aurangabad. She's a MBBS, DNB, M.N.A.M.S, a Derma, MBBS Dermatologist, Cosmetologist, and Trichologist. And it's our pleasure to host you today, Doctor. With that, let's dive into the first question. What is this fungal infection?
Thank you. Thank you so much for introducing me for the kind words. Yes, fungal infection is a very, very common infection. It's an opportunistic infection, which is very rampant, especially in India. Now it has been designated as having the score of as like an epidemic. So every third patient who comes to a dermatology clinic is a fungal infection. The infection occurs right from childhood up to elderly. It's more common in the immunocompromised individuals, like the elderly who cannot take care of themselves, or infants who are not given good hygiene uh, uh, lifestyle modifications. They who are not taken very well care of, or their nappies are not changed often, or they're not kept clean. Other than that, if they are kept very much covered in our hot and humid climate like India, so not only does it affect these extremes of age group, it also affects very our active individuals, professionals, people working outside, and it's more common in the hot and humid climate like rainy season and the summers. And this infection is actually rampant all over the world, but now it has taken the scale of an epidemic in India, and that is because it's very wrongly treated by the use of OTC products or by quacks, which give medicines or over the counter products like steroids, which actually increases the grip of the infection.
Right, right. We will definitely talk about this concern, Doctor. But tell us, does different area, like fungal infection in different area, have different causes behind it, or is it mostly the same?
Yes, there are a number of causes. Whenever these fungal infections are opportunistic infections, so whenever they get the opportunity to attack the body, they attack that particular area. They love humid and hot areas. So whenever children, or there are professional hazards like people who are continuously wearing footwear, with the profession requires the use of socks and shoes for long hours, they will acquire infections like athlete's foot, because continuously the foot is closed in a space. It's not given aeration, and the foot is sweating. The socks are there, the shoes are there. They don't have the opportunity to remove the shoes at any time. They're professionals. Also, it can occur to babies who are not clean properly, who are wearing diapers, or who are not cleaned regularly, checked regularly upon. It also can so in these patients, like in small children, it is more in the diaper area and the neck area, which is not lifted and cleaned regularly. Also, it can occur in immunocompromised individuals who are diabetics, or people who are lying down in bed for a long time, who are debilitated, who cannot take care of themselves. So, whenever there are conditions like they don't have much movement, not much aeration is given, especially in folds of the skin, the neck, the groins, they are more covered. They are often clean less often. So these are the areas which are more affected by these fungal infections.
Right, right. Now, coming back to the kind of fungal infection that we get to see, among those, let's talk about a few of them, which I think needs a little bit more concern. Uh, where comes nail fungal infection, doctor? Let's talk about this very stubborn kind of nail fungal infection which we are talking about here. We see mostly women in our household suffering from the kind of fungal infection we are talking about.
Right.
So how do we deal with it? The prevention also, can this be cured? Like, people have a lot of questions when it comes to nail fungal infection, because it usually takes a little time, I guess, right, to get cured.
Right.
So can you
Right.
please, yeah, can you please answer all the concerns regarding nail fungal infection?
So nail fungal infection is also very common, especially in women, because of a lot of wet
Mm-hmm,
work which they have to do in the household. If there's an active
mm-hmm,
lady who's taking care of the children and doing the household chores and looking after the kitchen chores, then in such conditions, these infections with time, with a lot of wet work happening and the nail remaining wet for a long time, exposed to the chemicals, exposed to the detergents, it gets compromised. The immunity of the nail gets compromised. The paranoia which
mm-hmm.
is there, it has got a protective layer, so that gets damaged, and so slowly these fungal infections take a grip over the nail roots. So these
Right.
infections are more common in people who are generally, with such cases, I always advise women that they should complete their wet work within 1 to 2 hours, whatever it is there. Maybe 1 or 2 hours in the daytime or 1 hour in the evening, and immediately dry up their hands and moisturize well. Because one factor which is very important is to take care to avoid such humid, constant, humid uh, opportunity to the fingernails, to the toenails, and do not keep it closed. Once your wet work is done, dry it and moisturize it so that there is a small epithelial layer which is on the nails, which protects the nail, the nail from different fungal infections. So if that is damaged, so we need to repair that, and we need to moisturize the skin well. And if it is damaged with constant detergents, then we have to take care that we cannot be putting your hands in detergents always. Complete your wet work, use gloves, complete the wet work in 1 to 2 hours. Do not constantly keep wetting the hands. Once the wet work is done, dry it completely, moisturize them so that you not have too much of dryness, which causes a lot of breaks, and the fungus does not enter the nails. Also, regularly taking care of the nail, cleaning it, examining it, will show early signs of fungal infections. If it be so, then there are a lot of nail products which are available, which are used as they are now designed in such a way that they are easy to use, like nail polish, and can be applied on the nails. And then early detection helps, because once the nail infection starts, it takes a lot of time for cure,
Right.
because the nail grows very slowly, and the infection also comes out very slowly. And whatever drugs we are basically using are more of static drugs, not cycle drugs, to treat nail infections. So prevention is
Mm-hmm.
more important in this condition.
Right. Doctor, what if somebody has been suffering from this sort of infection since a long time now? Are there possibilities that the person can be cured completely?
Yes, yes, definitely. This takes a little long time. Since we have to have some patience while treating nail infection, the
Right.
doctor as well as the patient. The results are seen slowly, because as the nail grows, the new nail comes out, and the healthy nail is non-infective. But the treatment has to be taken for a little longer duration, for at least a month, with oral drugs, as well as some topical medications which are applied on the nail in the form of
Mhm.
paints or nail polishes or lotions or gels or creams. And
Right.
as the body fights, and the medicines help these the infections, and all and along with it, we also have to give the advice regarding avoidance of wet work, avoidance of constant exposure to detergents, chemicals. These will all go together, and once these instructions are followed well, with time they will see changes in the nail, from starting from 1 to 2 weeks. And
Mhm.
the nail changes are seen from the root. The new nail starts coming in, and the nail from above starts shedding, and the fungal infection also starts falling off. And
Right.
the drugs which are used also remain for longer time, and then the nail will get cured, say, around in 3 months. So the patient
Right.
must bear some time and some patience, and continuously be consistent with the treatment.
Right. Right. Now, moving ahead, another kind of fungal infection which is commonly seen in the children, doctor, is the scalp fungal infection.
Right,
Because we are talking about children here, how do
right.
parents deal with it? It becomes very difficult for them to always monitor the children. So, yeah, how to deal with it and the correct treatment for the same.
So in children, the very common manifestations are of two types. One is called as the gray patch, and one is a very pustular wet type of fungal, which is common in the scalp. Now, the most important factor for our parents, we advise to our parents, is to keep the scalp hair short, so that if there is any kind of difference they see, any patch, any scaling, any pus formation, any nodule formation, they should immediately seek an expert's opinion. Also, continuous application of oil is not advisable, because it can cause a continuous increase in changes in the scalp moisturizer, the moisturizing the condition of the scalp. Also, we advise them to clean the scalp daily, because children are they are very active. Their sweat glands are active. The scalp is a major area where these sweat glands are active in children. They also lose a lot of heat from there. It should not be continuously kept closed, and they should be the caps or whatever cloth they may be using for covering their heads. It should be changed very frequently. It should be kept clean, and keep their hair short and wash it daily. The washing of hair daily really helps, because it decreases the colony count in the scalp and reduces the fungal infection chances. And children, many of the children have a habit of scratching their scalp with nails, so they should keep the nails of the children short. And also, we also advise that this is quite common in schools also. So we always advise that in schools there should be a regular examination of small children, so that it is detected earlier, and the
Right.
treatment is also started earlier in these cases.
Right. Doctor, because we are speaking about washing. So does personal hygiene also plays a very important role when you're talking about fungal infection? If yes, then how do we manage uh, the kind of preventions we need to take in a home setup if somebody is already suffering from the kind of infection? What are the kind of preventions a family member should take in?
If somebody suffering in the family already has infection, then such a person, I always advise that always keep your, first of all, the most important thing is just wear natural clothes, natural fiber like cotton or silk, which absorbs sweat. Do not over cover yourself with too many clothes, like layer on layer, and do not wear very thick clothes which avoid any radiation in the body. Secondly, they should keep changing clothes every 8 to 12 hours, not continuously wear the same clothes and sleep in the same clothes which they have been wearing throughout the day, because this is very important. The fungal infections spreads through fomites. And once whatever clothes you have, if you have worked very hard and if there's a lot of sweating, especially like in the gym, then you must immediately come home, take the shower, because that brings the colony count down. And wear
Mhm.
fresh clothes. Wash the clothes separately, and keep your body hygiene very very clean by taking a bath at least once a day. And if need be, if you're living in a hot and humid climate like Mumbai, or in all even in South India, it's very common. So in such areas, they should definitely take bath whenever needed, especially after a lot of sweating. Those people who have got fungal infections, and they should wear loose cotton airy clothes, which allow the skin to breathe, which allows the air to pass, and which aerates their body. Also, such people should keep their skin a little on the drier side, especially in those areas which are having the fungal infections. If they're having the infection in the foot, then they should wear open footwears. If they're having infection in the private areas, they should wear very loose cotton clothes. Do not sit for a very long time, because even people like drivers, they have special fungal infections called jockers itch because of long hours of sitting. Should take more breaks. And definitely hygiene is one of the most important factor, because that is what increases the fungal count every time when we see these patients coming in.
Right. Now, because you've also mentioned fungal infection in the intimate area, doctor,
Right.
we see women also suffering a lot from the kind of fungal infection. What about people who needs to visit the office setup on a regular basis and they need to use the public toilets? Preventions for them, the right treatment for fungal infection in the genital area or the groin area, let's say.
Yeah, so whenever whenever I have such patients, I always tell them that when you're using public toilets, see to it that you use your own tissue which you use on the toilet seat, and
Mm-hmm.
you wash well. Make your area dry very nicely with another clean tissue. Discard it, and whenever they have to wash with these areas, do not use. Many patients have the habit of using Dettol for such areas, which is very actually irritating to this area. It can cause more damage than any benefit. So instead of
Right.
using any antiseptic lotion, it's better to use very gentle. There are washes which are available, very gentle washes. Clean them with that. Do not use very hot water. Again, using hot water can be damaging. They can use neutral water, lukewarm water, or maybe tap water is sufficient with a normal temperature. Also, make it dry, and if need be, if they are wear very loose clothes, if need be, they can also use talcum powder in such areas for on a regular basis to keep it dry. If they are going out for work, if there are long hours of travel, they cannot come back home, or they have to sit for long hours, they have a desk job. So we also ask them to keep the area dry by using some kind of talc powder, regularly clean it, and then once they are back home, they should change all the clothes which they have been using throughout the day, wash the area, and use whatever fungal creams which have been advised. Do not use any over the counter product or any irritating lotions, or any antiseptics, so according to their whims and desires, because that can cause more harm. And just apply the medicine which has been advised, and wear very loose cotton clothes. Do not irritate or rub the area, which is of very utmost importance, and gradually they will see the results.
Right. Doctor, what about those personal hygiene washes which we get in the market? Should we actually use them? Is it fine if one does, or it's just a
Yeah,
marketing gimmick?
yeah. No, actually, some of the washes, people who have very, people who are diabetics, or people who have a very sensitive, dry skin. Now, these people, there are selective people who can use these washes for their benefit, because it is very gentle on the skin. It cleans well.
Mm,
It is matched with the acidic pH of the body also for the gentle area. So, in such patients, and
mm,
selected few does benefit, but it is not for everyone. It's not for all healthy
right.
individuals. Most of the healthy individuals, basically, they can just get along with just the water, keep the basic hygiene good, and use
Mm,
the medicines which have been advised. Not all
right.
antiseptics are going to help them. In fact, they can cause some damage. But you should not use things only on hearsay, on any hearsay account. They should always seek the experts' advice regarding this.
Right. Like I personally know a lot of girls who use washes because
Right.
of the foul smell, say, or the pungent smell. So is it okay if they are using because of the discharge or the smell issue?
They can use it, especially if the skin is little sensitive, on the sensitive side, which reacts more.
Mm-hmm,
It helps,
mm-hmm,
but using it is not a necessity for young, active, healthy individuals. It is not a
mm,
protocol of the line of medicine for them. But then for some people who have sensitive skin, yes, it does help, and it's okay if they use it also.
right. Now, moving ahead with the diet, doctor, we know that diet plays a very important role in our life in general. But what
Right.
about fungal infection? Any triggers if somebody is already suffering from the condition, or any do's and don'ts when it comes to fungal infection regarding diet?
Yes, yes. One thing is that especially diabetics should also take care of their diet. All those who are having diabetes should keep their sugars under control, because that is one thing which does not even allow the medicines to work. When we are fighting
Right,
infections in diabetics, the if the blood
right.
glucose are raised, then it becomes very difficult for us also to bring down the fungal infection count and bring down the disease, because the constant exposure to the glucose in the sweat, that increases the chances of the fungal growth, because the fungal thrives on this glucose, the sugar which is there in the sweat. Secondly, we always tell the patient that you should drink a lot of water, because water is one thing which can decrease the glucose concentration in the sweat which comes on the follicles. That is the diet of the
Mm,
fungus. So if you have a lot of water, the concentration of glucose and the concentration of other nutrients which are there in the sweat for the fungus comes down. So consumption of good amount of water, avoidance of high glycemic index foods, or sugary
mm,
food, or any junk foods which can cause a rise in the glucose. also avoiding thing, and also having a very good vitamin C and protein diet, which helps for fighting the fungal infections in general. Are We advise them to avoid outside food also. So this is one thing which they should take care of.
Right. So basically, what we recommend is sticking to basic, avoiding junks, which is anyway good for your health,
Yes,
vegetables, fruit. A basic simple diet would do wonders with the
yes,
sufficient amount of water. Now, when it comes to water, doctor, there is another condition which requires drinking a lot of water, which is UTI. Tell
right.
us, is there any correlation between UTI and fungal infection?
These both UTI and fungal infections are common in diabetics. They're also common in
Right.
people with renal transplant. They're also common in women, especially during their times of the period. So these are the infections which are opportunistic and can cause both, and both can be very irritating because fungal infections cause a lot of itching in the private area. UTI also causes a lot
Mm,
of burning, micturition. It also irritates the private area a lot. So in these combined situations, we sometimes have to do a urine test, and both are common, very common in diabetics also. So in these conditions, we always give a combination treatment, but we also ask the patient to take general precautions like drinking a lot of water, because that is one thing which helps both for UTI and for fungus. And the intimate
right.
care area, yes, they have to take care of it, because sometimes because of fungal infections, the area gets excoriated. And in UTI, there can be a lot of burning micturition also. Then again, they have a lot of irritation. So gentle care of the private area is also required, where they should be avoiding all kind of irritating things, or they should be avoiding any use of harsh soaps, or they should be avoiding. There are also some antifungal soaps which are available, which might help during the time of fungal infections. But basic good diet and good amount of water really helps.
Right. Now, speaking about irritation, you said we know, doctor, with our lifestyle and our diet, a regular workout is very important in our day-to-day life. So, what about fungal infection? What if the person is suffering from the same kind of infection? Is it okay if he or she is working out on a regular because it includes a lot of friction? A.
Yes, yes.
Second, should they opt for preventions using if they are working out on a gym setup on a regular basis? Can fungal infection be spreaded through gyms as well?
Yes, yes, that is a very important factor, because many of my patients I see, they have started some their regular gym workouts, and they come with fungal infections. Now, gym is one place
Mm-hmm.
where there's a lot of sweating goes on. Of course, what I advise them is that they should be taking an immediate shower after the gym, because that is the time when they sweat a lot. Sweat is an
Mm-hmm.
important factor in inducing fungal infections, and an immediate shower and change of clothes is very very important, because that is the time actually the fungal infection starts really. And because in gyms, it's a closed atmosphere, there are air conditions, but then the use of instruments, the use of machines are, and the spread is via these fomites, the machines and whatever they are using there. And also in gym, sometimes they are wearing very tight clothes, so I advise them that you can wear cotton pants, or do not wear synthetic tights, and wear cottons, wear them, make them loose, make it little loose, keep it thin. And if it is a possibility, do not share any towels at all in the gym or someone else's. If it is a possibility, take a shower then and there itself, because immediately after the sweat there is a window period where they should immediately take the shower and change the clothes. If their home is nearby, they can drive by, or they can go reach their home faster and just take a shower, change all the clothes, and also keep separate outfit for and towel for gym, and for their regular this. And whenever they are using any gym outfit, they should always use, every time they should use a fresh outfit. Do not use whatever you have used one day earlier, and without washing it, because these are the factors which actually cause, or it starts a basic fungal infection. Because once the sweat is there, it stays on the clothes, the fungus starts thriving on them. Sometimes even these fungus start on the clothes, and then they're transferred to the body of the patient when they are sweating. So that is important, that they should keep very clean clothes every time, wash their body and make it dry, and do not use or share clothes and things from the gym. So that is one thing which the people who are working out, but they can work out. Even people who are having fungal infections can work out on a day-to-day basis. The only thing is they should take a lot of care of hygiene. They are advised before the use of starting their gym, they should use a lot of powders in the intimate area because that will absorb the sweat. And immediately once their exercise or whatever workout is over, they can come back home and wash themselves and change everything.
Right. Well, those were the suggestions, the preventions that you can take in case if you're working out. Now, coming to the one of the most concerning issue when it comes to fungal infection is the recurrence of fungal infection, doctor. Why does it happen, and how do we deal with it?
Now, one of the most common reasons of fungal recurrence is the patient is not very compliant and not patient with the treatment, because see, nowadays we are using drugs which are static drugs most commonly. Static drugs
Right.
do not kill and function. They just hold on to the infection. They stop it at a particular level. Now the skin takes
Mhm.
over. The skin takes time to turn over. So till that time, the patient, once they start finding results, they stop treatment. Once they feel that they are not itchy and maybe it has responded, I should stop the medicine prematurely. Which is not right actually. They should use the medicine for, it's advisable in fact to use topicals 2 weeks more than the actual disappearance of the lesions, and to use complete the course of oral medication as suggested by different kind of infections by the expert, because if that is left incomplete, then there is a chance of recurrence. Second, also the main reason is because of use of steroids on from the over the counter products. A lot of patients we see, they avoid, instead of, their friend may be having the same problem, or somebody in the family may be having the same problem, or some chemist or somebody has advised them, okay, this medicine maybe you can use if you are having some trouble. So these commonly contain steroids. Now steroid is one thing that allows the body, the fungus to grow rampantly, because it will impair your immunity of your skin, and that allows the fungus to grow very fast. That is one reason the fungus takes a firmer grip on the skin and does not respond to medicines. And we have to take a history when the patient comes, that if they have been using any kind of over the counter product from the friend or from the
Mhm.
chemist, then they have to stop this medicine. They have to be counseled that the medicine has to be continued for a particular period, say 6 weeks or 12 weeks, or whatever the duration may be for their disease. And they have to complete the treatment and follow up, so that the recurrence of fungal infection comes down.
Right. Now, because we are talking about the treatments, doctor, what are the current treatments which are available to treat fungal infection? How do we diagnose the patient when he or she initially comes to us? And the first line of treatment followed by the kinds of treatments which are currently used.
Yeah, so if there's a small child or there is a healthy individual with just a single lesion somewhere on the face, or yeah, I also wanted to point out that the tinea on the face, fungal infections of the face are also very common in people who are shaving outside for men, or who
Right.
are using trimmers which are used commonly between in the parlors. So or in the men's saloon. So I
Mm.
always advise them, if you're using these services, please have your own instruments. Please buy your own instruments and use them only for your personal use. Do not share these products with someone else. And whenever there is any chance where you see where you start having some kind of itching, or you see some red lesion or a papule on your body, immediately the line of treatment they should seek an advice. And the first line of treatment are topical medications. There are antifungal drugs which are cidal, which can kill the fungus, and which are static, which can stop the fungus. The most commonly
Right.
used are in the powder forms and creams forms, which can be used for the patient who is healthy, who's just having a single lesion, a small patch, maybe just an very early fungal infection. For them, it helps. But if it has been since months, since weeks, and patient has not been responding, they have been ignoring the infection, then in such cases, oral medications are required. They need to be taken for at least 3 months before you actually call them, tell them that they are free of their infections. Both fungicidal and fungistatic drugs need to be taken, but there are certain side effects of the drugs, so it has to be customized for each patient. Some patients with heart problems, or some patients with some other issues may not be able to take one or the other drug. Then alternatives are suggested to them. There are also drugs which are specific for scalp infections, and they work well with children. It is also, the dosage is according to their weight of the body. And there are now for prevention, or people who are having have had fungal infection, for them we give a little longer treatment, especially by preventive care. We give them some powders so that they keep their intimate area dry. Antifungal powders are also available. If there are small babies who have just started some fungal infection around the neck, between the folds, or maybe the groin, we do not need to, we don't give them oral medications. We just can give them a form of powder or cream or gel in the form of a drug, and they can use that, and that helps them, because children, their skin responds very well to antifungals, and they get cleared of the infection very fast. Their turnover is also
Right.
faster.
Right. Now, because we are talking about the medications here, antifungals, let's say, doctor, we initially you told us that over-the-counter medications can be harmful, steroidal creams can be very harmful. It's very important to choose your expert also. Uh, like you mentioned earlier, that the right treatment is very important. People are not being treated in the right way. In such a manner, we see nowadays the kind of medications that treat fungal infections, those medications have somehow stopped working. So we need combination medications nowadays. We normally suggest, combination medications to the patients who are suffering from the same. So, doctor, why is this happening in such a rapid rate that the medications have literally stopped working nowadays?
See, one reason is because most important factor for treating fungal infection is diagnosis. Now, I have
Hmm.
many patients who come to me where they have taken medicines from not a skin expert, but a general practitioner, or maybe even a quack. Now, in such cases, they actually are not able to diagnose whether this is bacterial infection or fungal infection. So they give a
Right.
combination of treatment. Now, in such cases, when these combinations are given, they don't really work well, because when the skin is such a place where everything thrives in a in a symbiotic association. The skin has a biological film on the different areas. If we give antibacterial, the fungus thrives. If we give antifungal, the bacteria thrives. So when such combinations are given, when there is fungus is increased, and we give them a combination of antibacterial and antifungal, so the bacteria are inhibited. In fact, we don't want the bacterial inhibition at that time, because if we give antibacterial with antifungal, then there are chances of fungal infection rising. So combination is not suggested generally. If they go to a skin expert, the skin experts will never give you any combination products unless they see a bacterial infection with the fungal infection. So
Right.
most important factor is that you should take the right expert's opinion. Diagnosis is very important, that whether it is a fungal, whether the fungal is accompanied with eczema, or the fungal is accompanied with bacterial. Second, the patient should
Right.
have a lot of patience of completing the therapy, because if they are if they don't find, most of the OTC products have steroids, and the relief of symptoms like itching and redness is very fast with steroids. So if they do not have patients with the right antifungal, the itching does not come down as fast as the steroids. They feel a little desperate. They're not consoled. They start using steroids with them. So this is one thing that we always counsel the patient, that even if you have a slow response, let it be. Do not get worried. Do not add steroid or any other over-the-counter product, because that can cause more harm and increase the fungal growth, and as well as the bacterial growth, and compromise your skin immunity. So for the failing of the main reason is the non-compliance of the patient. The patient is losing, patience, and getting desperate about the treatment. The patient needs to be counseled. And secondly, do not use any. Get diagnosed very rightly. Do not go to a for see, the skin infections are such that they can be diagnosed only by the expert. Regular
Mm-hmm.
doctors or people who do not have the they're not experts. They do not have the eyes to understand and see that they are having mixed infection or maybe an eczema with the same. They may not be able to give them the right treatment. They may just advise. They just feel, okay, this may be bacterial, fungal, let us give a combination of both. So it is important that they get diagnosed with the right expert, which is of the utmost importance, and they acquire only the single best therapy, a single, I would say it's called the, if it is an antifungal, just give the, if it is a fungus, then just the antifungal would work. And if they give
Right.
combinations, obviously it is going to increase their problems. So right diagnosis and right treatment, and right consistency, and right duration is of these factors of utmost importance. And I have seen many patients do well after 5 or 6 years of suffering from fungal. We have seen them coming from villages, taking wrong treatment and extensive involvement of the body. If they just follow the right things, they get cured of this.
Right. Tell us, doctor, can long-term usage of fungal infection have any side effects on our health?
Uh, yes, sometimes these fungal infections, if they've been there for a very long time, they can invade your lesions, the skin deeper. They can invade the subcutaneous tissue, and especially if there is some kind of background problem with the associated disease with the patient. Suppose they are diabetics, or maybe a renal transplant, or maybe they are HIV positive or HbSAg positive, or they are on drugs which are for some other problem, autoimmune diseases, which they are taking steroids. Then such patients, they can have these fungal infections can invade the bloodstream, they can invade the deeper tissue, they can form the granulomas. And in COVID, we have definitely seen very, very bad outcomes and consequences of these fungal infections going deep, because there was a rampant use of steroids. These fungal infections can invade the brain also. Once they get access into the system of your blood, they can spread everywhere, from the lungs to the brain, to the ears, to the eyes, to the kidneys, to their liver, everywhere, and they can form colonies inside your system. So it's very, very important that you treat fungal. Long-term fungal infection should not be allowed to, prolong for a very long time. You should seek treatment. And if you are an immunocompromised individual, many people who are on steroids for some other different reason, they might be suffering from arthritis, or maybe some other autoimmune disease, or maybe they are diabetics, or maybe they are patients from renal transplant, or even people who have a low immunity because secondary to anemia or any other problem which might be there. Such people should be very, very careful, because these infections can, and we have seen tumors of fungal infection in the brain, which has been called as black fungus in the brain. These actually can spread into the bloodstream. So it is, so do not shun it away as a superficial infection. Must take treatment for that.
Right, right. With that, I can see a few questions coming up from the viewers. The first question comes from Gitika Sharma, asks, can nail fungal infection be caused by nail extensions?
Yes, nail extensions. If you have been using someone else, if you're sharing your nail extensions with your friend, someone who has fungal infection, or if you have been using these nail extensions after, many a times in the parlors, when they do your pedicure procedures, they actually remove the soft covering which is there which is there as a biological protective layer on the nail. So these procedures, they can, if not taken, if they are used for a longer time, for one time, maybe it may not be a harmful thing. But if there is a regular usage of these nail extensions, then they can harm your skin, and they cause fungal infections between people who are sharing, or maybe people, those who have damaged their lunula, which is a very small epithelium which is there on the skin of the nail. So these can, they can actually make you more prone to fungal infection. They do not cause fungal infection, but if there is an exposure to a fungal patient, or a fungal lesion, or a fungal colony somewhere, yes, you can get more prone to it. But if you're using a nail extension which is a new one, fresh one for the first time, and you've been using very infrequently, once in a while, it's okay. That doesn't cause the fungal infection, doesn't make it more prone.
Right. The next question comes from Deepak Saxena, asks, is it true that sweat and tight clothes make it worse? Like, do I really have to stop wearing gym leggings?
Yes, if you're working out, I would suggest you prefer a loose cotton clothes. And sweating, yes, sweating is something which increases the colony count of fungus. Generally, we ask our patients who are prone to fungal infection to avoid wearing any synthetic clothes. If you're wearing clothes which are from the natural fiber like cotton or silk, it is obviously very beneficial because it absorbs the sweat. Sweat is something which actually the fungus actually thrives on the cells and the nutrients from the sweat. So if you're sweating and the sweat does not get absorbed, it is stuck between your skin and your tight clothes. something like a synthetic tight if you're wearing, then that is one diet which you're providing the fungus. So if you're going to a gym, please wear cotton clothes, please wear loose fitting clothes, which actually allow the sweat to be evaporated, and do not cause the and do not cause a hot humid do not give the hot humid environment for the fungus to grow.
Right. The next question, doctor, comes from Adi Jain asks, why is my fungal infection spreading even after applying antifungal cream?
uh, if your fungus is not if in the initial first few couple of days, it might increase even with the treatment. But if it is consistently increasing after about a week also, it is not stopping, then your fungal infection might be resistant to the drug which you may be using as a topical agent. You might need or maybe if it is not resistant, then only topical therapy is not sufficient to contain it, then you may have to add an oral therapy also along with it to contain that infection. It might be a huge rampant infection which might be just taking over your body. Also, see if you're using are there any exaggerating factors which are constantly allowing your fungus to grow?
Right. And with that, we have the last question coming from Aditya Shivastava asks, if I stay wet, if I stay in wet clothes after getting caught in the rain, can that cause a fungal infection?
No, generally wet. If you're there in the wet clothes, say about for 2 hours, 3 hours, no, that does not cause fungal infection. Once in a while, if you're caught up in the rain, no. But if you are in a wet clothes for more than 7 to 8 hours. Suppose your pants are just wet, and you're a working professional. You go out to your office, and then you unfortunately face rains. Your socks are wet. So in these conditions, we ask the patients, or we tell the patients it is advisable to remove the wet socks and keep it, let it dry, let your skin breathe, or have some fresh air for at least 2 to 3 hours. And then you can wear some, or your pants also, you can just fold it up, or change it after 3 to 4 hours if possible, and make it dry with something else, whatever may be available with you at that time. For a few hours, no. For rainy season, once in a twice, if you get wet, it doesn't cause fungal infection. But for long hours of, if you are wet, that as redness and itching starts on the body, which can make your skin prone to the fungal infection. So you should not allow the wetness to stay for a very long time, say about 6 to 8 hours.
Right. Well, that was the last question for today's live. Doctor, we had a wonderful discussion today on the topic. Before we take a leave, any take home message for our viewers who has watched us so far?
Yes, I would like to give advice on. See, I feel the basic hygiene protocol should be very good with every person. Nowadays, when we are seeing so many professionals and young individuals coming with infection, I tell them that if you're working out, if you're in a gym, just take care of your basic hygiene. Take a wash immediately. Wear cotton clothes. Many of my patients who see fungal infections, I tell them do not use a lot of synthetic clothes, especially the innerwear or any kind of inner material they may be wearing for their gym, or maybe they are going out for a party. Please try and wear cotton inside, or use a cotton lining inside before you wear something, because that is one thing which should be followed well. The second thing I just want to tell is, just take an expert's opinion. That is the best one, single one best investment for you, because once you do have an infection or you do have a problem, the best thing you do to yourself or justice to yourself is seek the right treatment with the right doctor. So have
Right.
just keep your basic hygiene well, and just take the right treatment or the right advice when it is needed.
Well, that was the expert advice for today, and that was Dr. Nyla Ishtyaque for us. Thank you so much, Doctor, once again for your valuable time. It has been a very informative session for our viewers today, and we look forward to uh, many more such sessions in coming time. It was great to hear from you. Also, thank you,
Thank you,
viewers, for
thank
your
you.
excellent participation for today's session. Stay connected to our channel, and do not forget to subscribe to our YouTube channel, Radiance with You. We are also available on Instagram, Facebook, and Twitter. You all stay safe and stay healthy.
Thank
Thank
you so
you.
much. Thank you so much for having me. It was a wonderful time with you all. I enjoyed the session as much as you all. Thank you so much.
Same here, same here, ma'am.